Over 40,000 Americans have died from the coronavirus in just over 1 month's time. And yet the director of the CDC is warning the expected second wave later in the year could be even worse. As some states announce plans to reopen, Robert Redfield tells the Washington Post a second wave of coronavirus could be worse because it could coincide with the start of the flu season next winter. He discussed the strain that two simultaneous respiratory outbreaks would put on healthcare and urged state and federal officials to use the coming months to prepare. The CDC director stressed the importance of social distancing and called protests to lift stay-at-home orders, quote, not helpful. Yesterday, the president was asked what happens if the virus makes a comeback after social distancing guidelines are relaxed.
I would say that you keep away until this thing is gone. It's going to be gone at some point. It's going to be gone. And I would say you keep away and you do the social distancing until such time as you know it's gone. We'll know when that time is.
Well,
it's gone?
Yeah. Well,
okay.
Yeah. Well, listen, Willie,
18 months.
There has seemed over the past few days, the president, again, all over the place, but deferring more to his medical advisors. It is interesting, though, that yesterday the CDC, and thank God for it, the CDC came out and did warn about that second wave that we've heard others, and Anthony Fauci and others worry about, because the next wave could be far deadlier because it coincides with flu season. It will strain hospital resources anymore. But you just really hope, and you've got to believe, that a lot of the people that we see on TV every night, the doctors and others, and even the president, understand that we can't get caught off guard again, and that, yes, the fall may be worse even than what we've experienced this spring.
Yeah, that was a very sobering interview, a sobering statement from the CDC director yesterday, who said, let's pump the brakes on the celebration. Let's not have all this. It's going to be gone talk from the president of the United States. He wasn't addressing that directly, but it was a rebuttal to what the president had been saying up at the podium yesterday and the days before. And also perhaps a rebuttal to the rush to get everybody back into the workplace, which, of course, as we've said a million times, we understand. We want everybody to go to work, too. But if you go back too soon, you run the risk of this coming back and again. And even so, if we continue our social distancing, the CDC director warned this winter could be a bad one with, as you said, the sort of convergence of the flu and coronavirus at the same time. So happy talk, optimism on the one hand. This is going to be gone. Science, doctors, CDC directors saying not so fast.
So, Joe, we've been saying it from the beginning because the science doesn't change. Mm-hmm. The president's message might change. The politics of this might change. He might push people to, but the science doesn't. Mm-hmm. The virus is deadly. It doesn't care, what color you are, what political background you have, and it attacks people in sometimes very mysterious ways. Sometimes this virus can be carried from person to person without them having symptoms. The virus is very dangerous. That hasn't changed. Right. It will take 18 months. That hasn't changed to get a vaccine. OK, so we're not at testing, and the president refuses to put the full force of the government behind testing. So we don't have a roadmap to get through it. So here's the deal with his grand reopening. He likes to talk about it like it being a celebration. Mm-hmm. People aren't going to go pouring back into the streets and pouring back into coffee shops and pouring back into stores. They may never go to stores again. Actually, some stores may not make it through this because they were already competing like bookstores with online purchases. And other businesses, if they do open, Joe, it's going to be piecemeal. 6 people, 6 feet apart, long lines. They're not going to be able to have as many people in their businesses. The money is not going to come pouring back in. They're going to suffer and struggle even when we, quote, reopen.
Well, a lot to talk about there. At first, I hope, and I am hopeful here, that that scientists, our medical community, nurses, doctors, hospitals, and yes, governors and some leaders on the federal level, and hopefully even President Trump in some areas have learned some lessons over the past 3 months. have learned not to undersell this. The president, with his Liberate tweets, what he's even finding out a few days later is polling shows that stance is really hurting him with senior citizens. That stance is really hurting him with blue-collar workers. That stance is hurting him in Wisconsin. It's hurting him in swing states. So going for the 8%, you know, the 13 people and 4 hound dogs that hang out at the Michigan State Capitol may not be the best way to win an election in the fall. So I'm hopeful that you know, we are an exceptional country. We are the exceptional country. There, I said it. When it comes to science, when it comes to medicine, when it comes to research, when it comes to technology, when it comes to Nobel Prizes, we can do this. I'm hopeful that everybody's listening to Dr. Fauci and understands that this fall could be worse if, again, if we don't lean into this, if we're not ready. We can prepare. And what's going to be critical is we've got to work in a way where we learn to live with this deadly pandemic.
Right.
We figure out how to work with this deadly pandemic.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.